Good morning. On behalf of the RDIAC, my name is Jeff Cameron. It's my pleasure to welcome Mrs. Teresa Larue from Sherwood Park, Alberta. Teresa has been working as a care manager at the Jubilee Lodge in Edmonton. She's here to share her experiences and tell her story. For all the kids out there watching this today, all you have to do is click on the ID code and you will be entered automatically to win a gift card. It's very simple, so please take the time to do that and give us any feedback on how you feel about this. Teresa, thanks again for joining us today, and I will let you take it away.
Okay, sorry, Jeff, I got a quick question. I got a screen up here that says leave meeting or got it. Do you just want me to hit got it?
Yes.
Yeah. Hi, everybody. My name is Teresa. Like Jeff introduced, I am a care manager at Jubilee Lodge. I am a registered nurse. I initially started out working in acute care at the U of A hospital. I graduated in 1997, worked at the U of A for about 12 years, and then came here to long-term care in 2006. So my job here as a care manager includes various things. I do admissions and discharges. I do screening for admissions. I also do help out on the floor as a nurse when needed. I do staffing of healthcare aides and nurses. At our site here, we have many job opportunities, including registered nurses, licensed practical nurses, healthcare aides, dietary, laundry, housekeeping. I think that's about it. Our facility here, we have 156 beds. Our residents have varying ages and varying diagnoses. In long-term care at this time, over the years, the acuity of the patients has gotten much higher. So certain skills are needed both in nursing and in healthcare aid. Years ago, people would just come here kind of to live out the end of their years. Now they're coming with more medically acute issues that have to be taken care of. We have 5 doctors who assist us with that. Generally, they round on a weekly basis, but some only come quarterly, so every 3 months. We also have on-call doctors should we need in urgent situations. What else can I say? We have recreation programs here for the residents, even though some being quite ill, we still do have some who enjoy participation in things such as happy hours, bingos, reminiscing events. We have about 160 staffs total, all of different varying positions, including full-time, part-time, and casual. We do deal, like I said, again, with many different types of residents. We can range in age from anywhere from 42 years old right now to 105. So we always have to be cognizant of the different ages and people's different medical and cognitive needs. So we do a lot of work with our physio team, occupational therapy team, our rec team as well, along with the nurses. Long-term care can be a very challenging job. It's definitely hard work, a lot of physical work. Some of our residents do require a lot of care, sometimes often needing 2 persons, some mechanical lifts in place. They need all their care done for them, such as feeding, bathing, pretty much everything, whereas other of our residents just need a limited care. They're able to do a lot of things for themselves and only rely on the staff for just a little bit of assistance. In my role, I do deal a lot with families. There are family concerns that are sometimes brought forth that I have to deal with regularly. But generally our families are very compassionate, understanding. They realize that it's a big building with many people on each unit. We have 5 units in our building, and every long-term care varies. So some units have 35 residents per unit with about 4 healthcare aides. So often that means one healthcare aide is responsible for 8 to 10 residents based on the shift or staffing. So sometimes that can be a little bit overwhelming. We do have families that do help us out too, especially over the last couple of years. As you all know, with COVID, it has made things a lot more difficult. We did have restrictions for a while on visitations, so nobody was allowed into our building at the beginning of COVID. But now, even though we are still one of the few places in the medical field that still do require screening for COVID and mask protection in place, our visitors are now no longer restricted. So we do see a lot more families in, and the families are generally pretty great and pretty helpful. I think COVID on everybody in the medical profession over the last couple of years has been really difficult. It's really brought out strains in our system, and I think opened a lot of people's eyes about staffing, both in long-term care and acute care, that maybe hopefully will start being looked at, but that's hard to say. My job here also, besides dealing with our patients and families and staff, is really just to really make the residents' end of life as good as we possibly can to keep people comfortable, ensure that my staff are always working on that consistently, and hoping that we can do all we can during this time. Long-term care beds in particular, the last, I would say, 2 years are quite high in demand. A lot of people are choosing to stay at home and age at home, but then families are finding that care to become much more difficult and hard on them themselves. So we are noticing probably the last 3 months that a lot of families are finding that care is becoming too difficult for them to do at home. So they are, coming into long-term care, checking it out, and bringing their loved ones in here because they just they can't cope with the workload in the home, especially if they have a job, they have children. It is difficult to care for a loved one at home with high medical needs. What else can I say? I'm not sure if I think I may have forgotten something, but I'm not sure if I have anything I can add to that.
Well, Teresa, I'd just like to say, firstly, Alberta is the wild rose country, and you are definitely a rose for those people in the long-term care. I know firsthand of your caring heart, and all you have to do is listen to you talk. So I think as Canadians as a whole, we're in really good hands. And I think sometimes people forget that we always get looking for that next thing, and we have so much here. So I want to thank you first for the job that you do for the seniors and for the people that are in need, and even at younger ages. A question for you here. if the kids out there that are going to watch this, you mentioned RNs, and I believe you mentioned 160 staff total. So if someone didn't want to spend 5 years in school and so forth, what are the other types of nurses perhaps that the high school students could be looking at?
So that is something that has also changed over the last couple of years, and actually a really frustrating change on my end, because initially when I first started here, healthcare aides, which is my main people that I hire, healthcare aides did not require schooling. They actually didn't even require experience. I could literally just hire someone who interviewed well, who I thought was compassionate, would do a good job. But now it's just recently changed that healthcare aides have to actually join a healthcare aide. I wouldn't call it a union, but they have to do have schooling. It's not a long bit of schooling. I think right now it's under 6 months. So they do have to have that healthcare aide schooling, which is new for us in the last couple of years. So unfortunately, besides here, the only areas that don't require schooling here is housekeeping and laundry and the kitchen staff. But now pretty much every position does require some type of schooling, and that's in Alberta. I don't know for sure if that is different in Saskatchewan, because it could be. Like I said, at one time here, we did have that as well. So it might have changed for Saskatchewan too.
Right. So what can you tell the kids then that, of course, kids are looking for wages and comparing different sectors and stuff. So what could you tell the kids about if you went for 6 months, let's say, or an RN? Is there a big gap in wages, or can you make a living?
You can make a living, definitely. The RN and LPN wages are definitely comparable to acute care sites. The healthcare aide wages right now are better because we still have the $2 more an hour for COVID pay. That we haven't heard yet if that will go away. But as a healthcare aide, personally, I find it still too low of a wage. With the $2 extra that we've been able to use over the last couple of years, I have found it a better wage for the healthcare aides for sure. But I still, and will always say, I still think that for the work they do, it should be a higher wage for them. They can make, with no experience in Alberta here, with the COVID $2 an hour in place, anywhere from 2020, so $20.20 an hour to $25.15 an hour for healthcare aides.
Well, thank you very much. Kevin, Gord?
No, I don't have any questions, Teresa. Just like Jeff said, though, thank you very much for the work you do and all of your colleagues in all provinces. It's been a trying 2 years for sure, and beyond probably.
Yeah, absolutely. I don't think anyone ever would have imagined what COVID has done to all medical areas over the last couple of years, really.
Just a question, Teresa. You started out in acute care as a nurse, and what drew you to the long-term care?
So actually a friend, she came here to be the director of this building, and I had actually trained her in acute care. And after she had went on a maternity leave, she had been approached to take the job of director here. So she had asked me if I would think about it. And I'm usually a person that doesn't cope with change well myself. So it was a really big decision for me to make. Totally different acute care and long-term care. You learn so much in each site, but I'm definitely grateful I had the acute care experience before coming here, because it really opened my eyes. Being in acute care initially, I always thought long-term care was, easier, and what are they complaining about? They don't have the work to do that we do. But I was definitely surprised by the amount of work that goes into long-term care for sure.
It certainly is a special job where you get to really contribute and help people, different stages of their lives. So thank you very much for the work. And I know it's been incredibly challenging for you folks the last couple of years, and for your patients too.
Absolutely. Yeah. The patients, the families, and the staff, I think everybody has been challenged, but it's looking like we're, besides having to wear a mask, which we're more than happy to do, it's looking like we're slowly going to be returning to normal.
Awesome. Well, thank you very much for your presentation. And I know that your industry will be one that keeps growing and the demand keeps growing. So as a baby boomers age. So thank you.
Thank you.
Yeah, thank you so much, Teresa. And I just can't imagine the relationships that you develop with the elderly and so forth. And then when they do become ill, of course, there's always an end result, and you must have your heart broken day in, day out, actually. And just want you to know that the things that you do are very much appreciated, and for them also. And I'd just like to tell the kids that are watching that, if this is something that you're interested in, helping elderly people and even people that are younger that are sick and need this acute care, then this is something that you should be looking at. You had mentioned there's 160 staff total. If you enjoy what you're doing, then you never really have to go to work again. You have to work, but at least you're enjoying it. So I would tell the students out there, if this is something that they think they might enjoy, make that step, because it is so valuable to the people in Canada and around the world. So thank you so much, Teresa, for joining us here today. I know you're a very busy lady, and take care.
Thanks, Jeff.